Hello and welcome to this special show on Rajya Sabha Television. I am Vishal Dahiya and here we take a stock of India's fight against COVID-19. Now, recently, the Health Ministry has come out with specific guidelines for the post-COVID management protocol. That is, for those patients who are recovering from COVID-19, what needs to be done by them individually, the caregivers, as well as from the community point of view in terms of ensuring that their recovery from COVID-19 is smooth and they recover soon and become healthy as soon as possible. For more on this, we're joined by a distinguished panel of guests with whom we'll try and understand as to what exactly are these protocols and how can they be implemented by those patients who are recovering and their caregivers as well. So let me first introduce the guests here. We have with us Dr. Samiran Panda. He is Scientist G and head of the ECD division at ICMR in New Delhi. We are also joined by Dr. Gurtoo, Director Professor and head of the Department of Medicine at Lady Hardinge Medical College in New Delhi, and Professor Tanuja Manoj Nesari, Director of All India Institute of Ayurveda in the National Capital. Welcome, all of you, to Rajya Sabha TV. Let me begin with you, Dr. Panda, and let's start by making our viewers understand the finer points of this post-COVID management protocol, which has been put in public domain by the Health Ministry. Dr. Panda?
Thank you, Mr. Vishal. Before we get into the discussion, deep into the discussion around the management protocol for post-COVID-19 situation, or as it is also called long COVID, that is the term which people are more familiar with. When do we, for any infectious disease, we generally use three terms. One is the acute stage of infection, and then intermediate phenomena, and long-term sequelae or complications or effects or aftermath of an infection. Generally, when an infection takes place and gets resolved or comes up with an outcome, unfortunate outcome like fatality even, or recovery, within 6 weeks' time, we call it as an acute phenomenon. But when anything that stays for 6 months or more, we say, okay, this is a chronic infection. And then a chronic infection could also have long-term sequelae or effect. I will use first some of the examples that common people are familiar with. For example, hepatitis B or hepatitis C. These are the viral infections. And most of the people who get hepatitis B infection, 80% of them sort of are able to get out of it without even any jaundice happening. So there is no manifestation of the acute infection that happens. They go unnoticed and people resolve the infections with the help of their immune system. But those who become the chronic carrier, they get to see the long-term effect of hepatitis B in our body after 20 years or 30 years in the form of cirrhosis of liver. Same happens with hepatitis C, where the larger number of proportions fail to clear off the infection, and the long-term sequelae of fatigue, chronic fatigue, or cirrhosis or liver cancer happen.
Okay.
Now, coming back to COVID-19, we were familiar with the acute phenomenon, but as we are spending more time with the infection, because India as a country is living with COVID-19 situation for 7 to 8 months. So it's the time we have for recognizing or appreciating what happens when somebody recovers from COVID-19. Death or fatality is a different issue altogether. But if I get infected with COVID, I come out of it, and that takes generally 4 to 6 weeks. We will recognize this as the acute phenomena or the manifestations of the disease immediately following infection. But as there are people now, many people in India who have successfully come out of that acute phase of infection and the effects of it, meaning the fever is gone, the breathlessness which was there very acutely present is gone, and the headache which that person was suffering from during the acute infection is gone. What is happening with them now? A substantial proportion of them are now complaining of even persistence of loss of smell and sometimes headache, fatigue. As I did talk about the chronic hepatitis C infection, a similar phenomena, fatigue, and all of these symptoms actually negatively impact upon the quality of life of a person who has passed through this. So COVID-19, or more specifically or more accurately, we should say that infection with SARS-CoV-2 does not end in terms of its effect after 4 to 6 weeks of infection.
Okay.
But we are now experiencing people who are living with the aftermath or after effect of COVID. And this management guideline, which has come up now from the Ministry of Health and Family Welfare, deals or focuses on that.
Okay, so this integrated, a holistic approach, which is being pointed out in those guidelines, specifically the post-COVID management protocol, is to deal with the post-COVID symptoms, something we discussed earlier in our show as well. And I'm pretty sure, Dr. Gurtoo, you will remember that part because you're there and you quoted some examples from your experience in dealing with the COVID-19 patients as well as in post-COVID symptoms. Now, if we look at those particular scenarios, Dr. Gurtoo, and the way, the guidelines here point out to the post-COVID management protocol, how would you see, based on your experience on a daily basis on the ground dealing with these kind of patients, how would things move from here onwards and how beneficial would this protocol be?
Yes, so this protocol essentially sums up whatever knowledge we have acquired until today, which when we began with the COVID in March, we thought it was predominantly a respiratory disorder. With time, increasingly, we have come to see it as a far larger disorder, which spreads across from everywhere, brain to the blood. So the approach has also to get equally integrated. So today, it's not just lungs or the fever. It is mind, spirit, body, considered as one holistic integrated system. And that systems approach is what we require to manage the post-COVID syndrome. So in that sense, this new guideline speaks of reconstructing normalcy of a broken day-to-day life, which is thoroughly broken and shattered under the impact of COVID, how to reconstruct it into a new normal, how to do that. And it talks of an integrated approach. That is, if I can summarize it in 4 or 5 words,
please,
I would say accept, adapt, pace, simplify. Accept. The first thing is we have to accept that the new normal is not going to be the old normal, at least for some time to come, and not fight that realities, which any fight with the reality creates a lot of dissonance and depression and even a sort of hopelessness. So accept. It is a new normal in my life. I'm not the way as I used to be, and it may continue for some time while. Accept the reality as it is. That's the first thing that this guideline says it very clearly. Construct new normal routines out of the ones that are broken down. 2, adapt. It talks about adapting our day-to-day life around the core symptom of fatigue and energy loss. The core symptom of this is loss of energy, fatigue, both mental and physical exhaustion, sense of energylessness. So adapt your life around this fatigue and loss of energy rather than other way around. That is the second thing. Pace. It says that you get back to normal life at home and at work as fast as you can, but not at the way you were before the episode, before the illness. You pace your work with rest, rest with work, work, rest, work, rest. So little bit by little bit, you build up your normal routines at home, the point at which you wake up in the morning and what you do, the rituals, and towards the end of your home day, and likewise for your work.
Okay.
So pace, not too much rest, it'll harm you. Not too much physical activity, it'll break you down. So you pace by adapting it around your energy levels after accepting the realities as they are. The last important word, I'm summarizing this, it is not the word used in the ministry, this thing is simplify. Simplification meaning that life is very complex. Even just think of it, waking up in the morning and getting through the morning rituals of the first 3-4 hours is hell of a lot of complex life. Break it down into simpler goals which can be managed one at a time so that we remain paced and adapted to the new low energy levels that we have acquired after post-COVID. So you have to reconstruct a new normal after accepting the realities as they are, adapting your life, home and work around the new exhaustion and energylessness, the state you are in now. Third, pace. Break down the whole life patterns into smaller chunks, and with every energy expenditure from any activity at home or at work, give a rest, recover, do it again, rest, recover, do it again, and simplify, and get back to the normal, to as close to normal as you can, while accepting the realities at home and at work as fast as your energy levels permit. So this in the sum is the model that I think this things suggests.
New management, new COVID, post-COVID management protocol is hinting at.
Protocol.
Thank you, Dr. Gurtoo. Wonderful, and you summed it up very rightly. It is all about reconstructing a new normal, but doing it in a very simple way and in a paced manner, so that we don't end up, or specifically those patients who are recovering from, COVID-19, do not end up outpacing themselves or unnecessarily tiring themselves. It's, in fact, an integrated, holistic approach. Let me bring in Professor Tanuja here. Professor Tanuja, from your point of view, do you also see it exactly the same way as Dr. Gurtoo and Dr. Panda is pointing out in terms of a holistic approach to recovery?
Yeah, I fully support what Dr. Gurtoo and Dr. Panda mentioned. And the Ayurveda, as it is a holistic science, and when it is said that this new normal, definition of new normal in the post-COVID era, and what actually the protocol suggests, that it tells us the way how to live, and how to live in coexistence with the COVID, how to live with the COVID. And even those who really have had an infection after the post-COVID, what we also at All India Institute of Ayurveda in the CSC, COVID Health Center, and all the workers, what we are observing is more and more fatigue, and it is a mental trauma and the stigma what the patient they carry. So this protocol is the most balanced protocol, and it first time in India where this indigenous system of India coexists. And we have really our age-old wisdom of integrated knowledge. So if we integrate the knowledge of East and West, I think that becomes the holistic integrated protocol. Okay. So yes, and this protocol has really first time Health Ministry has recommended use of Ayush simple intervention, as it was said that adaptogenic and the simple one. So Ayush adaptogenic rasayanas, those are the adaptogens, immune promoting measures like Avla, Giloy and Ashwagandha have been introduced. And for the which are really very good to restore the health, minimize the fatigue, and really good for the building up the muscular strength, restore the system, and for the mental strength, and even for the respiratory, in building up the respiratory immunity and the vascular integrity, anti-inflammatory and other effects. This rasayanas, as well as pranayam, yoga, that is also very important. And this Ayush, this new protocol, which is integrative protocol, speaks about the general measures, even like gargling and at the physical level, doing the exercise, yoga, asanas, and a very specific measure to take healthy, fresh food and simple rejuvenating herbs inclusion, and even the immunity boosting kadha and kashai. So I really congratulate, and it's really very, very integrated, holistic approach where harmony with the mind, body, and the external environment is also considered. And as rightly pointed out by Dr. Gurtoo, it is like it helps us to adjust, to adapt, and also to have the space also, and to have the simplicity, all the measures which are very, very simple to adopt.
Okay.
So I think this is very inclusive. One has to practice it.
Okay, quite an inclusive approach, as Professor Tanuja is also pointing out, in terms of taking out the benefits of all kind of medicines we have in terms of immunity promoting Ayush medicine, as something Professor Tanuja was pointing out. Let me bring in Dr. Panda here. Dr. Panda, one more aspect of the COVID, post-COVID management protocol here is it's not only about individual, but it's also about involvement of the community. And this is a sort of a two-way process. When we talk about individual, those patients who are recovering from COVID-19, they also need to reciprocate towards the community, and the community also needs to go ahead and lend their helping hand as and when required. So that also seemingly is a very important aspect here. It's not only about just medicines and rest and treatment.
Absolutely. This is a very important aspect. But before I go into this straight, while I was listening to Professor Dr. Gurtoo, he did talk about two A's, which is accept and adapt. And the other 2 points that he said can also be captured by 2 other A's. One is acclimatization. When we go uphill, we do not move quickly. So we acclimatize, we allow our system to acclimatize. So the third A could be acclimatization. I will elaborate what do I mean by that. If post-COVID, I have compromised lung function and suddenly the acute phase is over and I overzealously start doing exercise, yoga, pranayam, or whatever I do, anything overdone is not good. So we have to slowly acclimatize the amount of exercise I would do. The fourth A, I could still convert it into another A, which is all will be well. Giving that message to yourself is a positive way of living, and
positive
that
thoughts.
will make yes, and that will make life simple. So the 4 A's, and the fifth one is exactly addressing the issue that you raised, association. So if you are in association of people who have successfully overcome the infection and now they are coping with their health situation very positively, they can really play a big role in bringing hope and helping people to deal with their post-COVID situation. So now, Mr. Vishal, I think that in today's program, we have really come up with nice, interesting 5 A's, which could be a good tool. The sixth point that I would like to highlight is that many of the COVID-infected individuals who will successfully overcome the acute stage of infection will also might have comorbidities like diabetes or hypertension or COPD. So if they're having other system of medicines, for example, let's say allopathic system of medicine, it would always be very important for them to consult the doctors in order to explore the possibility, if any, drug-drug interaction. So that needs to be avoided. So by all means, it's not doing one thing and neglecting, thinking that, oh, okay, if I'm taking these kind of lifestyle and these medicines, I can neglect my long associated comorbidities. So those need to be taken care of. So nothing can be neglected or exchanged for another. Okay. So the point I'm trying to make is that basically not only accepting, but also avoiding. So that could be the sixth point, avoiding any drastic change or step in my disease-related management that I was practicing before COVID. If I was, having medicines for diabetes or hypertension or COPD or any chronic disease for that matter. So I should avoid bringing in a drastic change in there, because that might complicate the post-COVID situation. Because COVID per se would have certain compromised function, be it of lung, be it of my olfaction, meaning my ability to smell, and the other body parts, even the myocarditis or the effect on heart,
Okay.
Or brain. So these are the 6 A's I would probably harp upon.
Okay, definitely wonderfully summed up once again. And, going a step further ahead, what Dr. Gurtoo was pointing out, but clearly, what Dr. Panda is pointing out here is that one cannot let the guard down in any case. And obviously, all these aspects will need to be looked into. Coming back to the community part, and obviously the way the positive thoughts are really, really important, keeping that positivity in life, specifically during this particular, post-COVID management protocol. And the mental health also has been a really, really important issue here, Dr. Gurtoo. So that is where the community becomes really, really important in this overall scheme of things.
Yeah. So if we frame the whole approach at the community level, then as an individual, if I have recovered from COVID and I'm suffering from, let's say, post-COVID syndrome, so there will be 2 levels. One, as an individual, I am having thoughts and feelings associated with those thoughts. Those thoughts could be classified into 3 broad templates or frames. One, hopelessness. I feel when I look at the future, standing here today, that nothing is going to improve. It's all hopeless. And that generates helplessness. I can do nothing. I've lost all locus of control over my own life. Hopelessness, helplessness, and over time that leads to a sense of worthlessness. I'm no good anymore. So this triad, this of hopelessness, helplessness, and worthlessness, they generate thinking patterns. 3 thinking patterns are born out of these 3 templates of mind. So I have to counter them. If I go and flow with these 3 templates, then the emotions that emerge in response to these 3 templates, thoughts, are all negative. They are anxiety, depression, and general sense of doom, which is not so really, not so at all. Almost all will recover. All will recover. Very few will have mild and can easily adapt. But at the moment when I'm down with post-COVID, the world seems to have come to an end because of that hopelessness, helplessness, and worthlessness, and the corresponding strong emotions that are born, that come out of them. So as an individual, I have to deal with this constellation, this complex of negativity. How do I deal with it? I will need community support at 2 levels. One, I connect with similar people who have had COVID, have suffered post-COVID syndromes, and have recovered, or are at a stage better or exactly as me, or maybe even worse than me. So there's a whole spectrum of recovery, from recovered to not recovered to very bad to somewhat bad. I have to connect with that spectrum of post-COVID in my community, and that connection should lead to consolidation of self-help groups. These could be media, social app-based, or whatever way. But we have to encourage at the local leadership to form these self-help groups at wherever, as small a community as a residential complex. The RWAs could play a leadership role in forming such things, such self-help groups. So when I talk to someone who is worse than me, I feel encouraged. When I talk to someone who has gone through my phase and recovered, I gain positivity. When I talk to someone who's struggling at the same level as I am, I feel motivated. So that sense of inspiration, motivation, and positivity flows in through these cross-connected self-help groups, which should be encouraged at all levels of community, the smallest to the largest. And this is the role of leadership, which the RWAs and local leaders will have to take now. The second, community connect, is a bit different. Now, all COVIDs, even if I formed a self-help group of post-COVIDs, all of us will still feel very vulnerable, isolated, and fear stigma. Or people will just say drama kar raha hai, ye to kuch nahi hai, kaam nahi karna chahta. So I fear the negativity of the social condition around me, which doesn't really understand what's going on in me and people like me post-COVID. So at another level, the social supports have to come from those who have not suffered COVID, who are the majority, and those social supports will connect with this small self-help group and groups of post-COVID and support them. No, we know you are suffering, but we know that you will recover and we are with you. We know it's genuine and it's real. And at the two levels, so general support from the general community and more focused support from the post-COVID community.
Okay.
These are the two levels at which we have to organize socially.
Okay, so these particular two levels is where, you know, it's going to be a two-way communication process and efforts will have to be made from both sides. Let's have concluding comments from Professor Tanuja on this aspect before we bring this to an end. Professor Tanuja?
Actually, I just would like to share a success story what we are doing at All India Institute. The name itself of the COVID activity is a care with compassion. So it is the mind, the mental support, psychological support that we had to give, and the feedback of one patient I would like to share quickly. It is, they say that are positive, COVID positive, we became negative, but we have become the positive. That is a mental attitude, the positivity, the mental framework that needs to be created, and that comes through the recreation activity. So I just would like to add here in the row of adding all A from Dr. Gurtoo and Panda, I would like to add A, that is Ayurveda, into the day-to-day practice. I think that will make everyone's life healthy as well as happy in post-COVID era. Thank you.
Thank you so much, Professor Tanuja out there, Dr. Anil Gurtoo, Dr. Samiran and Panda, for sharing your time and views with us and our viewers on this very important aspect. So, as our panelists are pointing out, the post-COVID management protocol is all about ensuring that you reconstruct the new normal, pace out your activities, also ensure that you keep positive thoughts in mind, and let's not forget that the regular checkups and ensuring that you're taking your medications is also being done on time at regular intervals. It's all about keeping a positive outlook and ensuring that you recover soon, and obviously connecting with everybody in the community as well. And as a community, we also need to go ahead and lend a supporting hand to all those who are recovering from this particular disease. We'll come back again with a different topic and different set of guests. Till then, you keep watching Rajya Sabha television, but please do not forget to wear a face mask when you step out of your houses, because this is the best defense against COVID-19 as of now. Thank you.